Okay, cancer in general, the main thing is to kill all the cancer cells. Chemotherapy, side effects include fatigue. You just want to make sure you tell the patient to get some rest and sleep. I wish they would do that for us. Memory, you just suggest notebooks and calendars. Stomatitis, if they had any type of ulcers in their mouth, that's stomatitis. You just suggest that they rinse their mouth out with normal saline or non-alcoholic mouthwash. You provide them with cold and soft foods and no hot, spicy, or citrusy foods such as oranges or tomatoes. If infiltration occurs, you DC the IV stat. Constipation or diarrhea can occur with chemotherapeutic drugs. You just want to make sure you increase the fiber in the fluids if they're having constipation, and if they're having diarrhea, no dairy products, decrease the fiber in the residue, and no increased fat intake, fried food, and seasoned foods. That's my problem. Tumor Lysis syndrome. Tumor Lysis syndrome basically means signs and symptoms that occur as a result of killing the tumor. So when you're killing the tumor, you're killing actual good cells. And when you're killing those good cells, you're causing everything inside that cell to escape the cell and go into the bloodstream. So your fluid and electrolytes are going to be all out of whack. Your potassium is going to increase and your uric acid is going to increase. And as a result of your kidneys having trouble filtering the potassium and the uric acid, your BUN and your creatinine is going to be increased. For some reason, your phosphate is increased, and as a result of that, your calcium will be decreased. So you're going to have weakness, muscle cramps, diarrhea, nausea, vomiting, and flank pain. The main goal for this is to prevent renal and electrolyte imbalance. So the therapies, the primary therapies for tumor lysis syndrome is hydration therapy to increase urine production and allopurinol to decrease uric acid production. For nausea, you just want to make sure you give the patient antiemetics 1 hour before you give them the chemotherapeutic drugs. Radiation, for some reason you can become lactose intolerant, so make sure you don't give the patient dairy foods, or you tell the patient not to get to any dairy foods in their diet. There's going to be marks wherever the implants of radiation are, so you just make sure that the patient understands not to wash those marks off. No lotions in that area, no soaps in that area, no swimming, and no hot tubs should be allowed for the patient, because we need to know where that implant is. For colostomy bags, I don't know, she said that there's going to be colostomy, so main thing with that is just watch out for the signs and symptoms of infection on the skin. The problems for cancer in general include obviously potential for infection. Wash hands, cook and wash the food, and the pain. You want to give around-the-clock pain medication and not the PRN pain medication. There's going to be superior vena cava syndrome that could happen if there's going to be a tumor inside the chest area. So the signs and symptoms of that would be facial edema, periorbital distension of veins, head, neck, chest, headache, and seizures. Just think of something just stopping up your blood from your chest up, and everything's just going to be just all bloated up here. It's most common with non-Hodgkin's lymphoma, because that's whenever the cervical lymph nodes are involved with the tumor, or metastatic breast cancer, and that's in the chest wall. Treatment includes radiation therapy because they want to make that tumor as small as possible. Labs for cancer in general would be neutrophils. They need to be between 2,200 to 7,700. It is considered neutropenia when the absolute neutrophil count is less than 1,000. Platelets include should be 150,000 to 400,000, and white blood cells should be 5,000 to 10,000. Medications include filgrastim, which helps the patient's bone marrow increase white blood cell count. Filgrastim is also known as Neupogen, and it's good for patients who have neutropenia or decreased white blood cells. Dexamethasone decreases the swelling for patients who might have cerebral edema if they have a tumor inside the brain. Okay, moving on to leukemia. In a patient with leukemia, there is a possibility that they can have neutropenia, which, as I said, is with the ANC less than 1,000. Problems would be if they have any type of signs and symptoms of infection, such as 100.4 Fahrenheit temperature fever, if they have crackles in the lungs or any kind of redness or swelling in the subcutaneous tissues throughout the body, you need to get the labs, assess the patient, and call the doctor ASAP because it is considered a medical emergency for a patient with neutropenia. They can deteriorate rapidly. For a patient who is pediatric and they are about to be DC'd with the parents, you want to make sure that you teach the parents not to use rectal temperatures. However, they need to know how to monitor temperatures for the patient. Just don't use the rectal temperatures because that could proliferate the rectal mucosa and cause the patient to have other complications. The patient is going to be susceptible to infection, so you want to make sure that the parents understand no live vaccines, or the patient understands that they don't get no live vaccines, such as the nasal flu vaccine or the MMR or the varicella. The white blood cell counts need to be monitored, and if they're going to have any type of oral care with the dentist, they need to make sure that they have prophylactic antibiotics and that they see their cancer doctor first. Risk for bleeding includes monitoring platelet levels, obviously, and neutropenic precautions are brushing your teeth 4 times daily with the soft bristle toothbrush, of course. You floss the teeth once a day. No alcohol, no gardening. Avoid all crowds. Wear a mask at all times if you're around sick people or if you're around a lot of people, if you have to be. No uncooked meats, seafoods, eggs, and make sure you shower daily, obviously. Skin cancer, the main diagnostic procedure for that is a punch biopsy. Risk include advanced age, sun exposure, tanning booth, and precautions are make sure that you're not around the sun between the hours of 9 a.m. to 5 p.m. Basically, be a vampire. Treatments include cryotherapy, so that's whenever you just freeze the abnormal growth and it causes the area to slough off and new skin grows over. That can be used for basal cell carcinomas. And white excision is whenever there is malignant melanoma, and this sometimes requires skin grafting. Signs and symptoms of skin cancer: whenever there's a hardened nodule, and also you want to think about A, B, C, D, E. A stands for asymmetry. B stands for border, irregular borders. C stands for change in color. D stands for diameter greater than 6 millimeters, which if you need a picture of it, it's greater than a pencil eraser. And I don't know what E stands for. Breast cancer. Breast cancer signs and symptoms are ironic because if it is painful, it is benign. If it is painless, it is malignant. If the tumor is immobile and it's fixed, that means that it is malignant. And if it can move, that means it is benign. If it metastasized, or basically, I can't say that word, if it moves to your bones, your calcium's blood levels can expect to rise, and you may have muscle weakness as a result of the increased calcium. For teaching the patient, you want to make sure that you teach the patient to do breast self-exams every month, and make sure that they get the telospense, which is basically in the armpit area, and don't forget the nipple area. Doxorubicin is a chemotherapeutic drug that can cause cardiotoxicity, so you want to make sure you monitor for any abnormal heart rates or dysrhythmias with the pulse or the apical pulse. Biopsy is basically the diagnostic test for that one. There's a lot of procedures that you can use to treat. The patient has a lot of options. Some of them include lumpectomy, when you take out just the lump. There's lymph node dissection, when you take out the lymph nodes. Simple mastectomy, when you take out just the breast tissue. Modified radical mastectomy is whenever you take out the breast tissue and the nodules. And radical mastectomy is whenever you take out the muscles, the breast tissue, and the nodules. Pre-op, you want to make sure the patient knows all of this stuff. Post-op, you want to make sure the patient understands that there's no blood pressures, no venipunctures on that site, and that they know how to change the dressing, and that they will be sent home with a drain. Make sure that they know the proper functioning of the drain. Radiation has been proven to be most effective in preventing recurrence of breast cancer with lumpectomy. Going on to colon cancer, the CEA is going to be evaluated every few months, and that's CEA, and that stands for carcinoembryonic antigen. That's going to be monitored every few months, and if it steadily increases, you want to be concerned for the possibility of cancer being recurring. For colon cancers, you want to monitor the Hemoccult and the guaiac test. This will tell you if there's bleeding in the stools. And then familial polyposis is basically when you just have the gene, or your family has the genes to get polyps that can turn malignant. Problems for colon cancer: when you administer the chemotherapeutic drugs IV over 4 hours, you want to watch for fluid overload. For lymphoma, there's Hodgkin's and then there's non-Hodgkin's. For Hodgkin's, this is the one with the worst prognosis. It occurs with tumors that happen inside the B cells, or the B lymphocytes, and 70% of the tumors occur in the cervical lymph nodes. And this is a possibility that you can have superior vena cava syndrome. The Reed-Sternberg cells are a hallmark for this specific cancer. And non-Hodgkin's includes the B and the T cells, and it's not as a bad prognosis as the regular Hodgkin's disease. For grief, I'm running out of time here, but grief, basically you just want to make sure that you explain, have the patient express their feelings. If they're terminally ill, they will have anticipatory grieving. Make sure you know the stages of grief would be DABDA, D-A-B-D-A, and which would be depression, anger, bargaining, denial, anger, bargaining, depression, and acceptance. Congenital abnormalities, you want to let the parents know that being sad is normal. It's okay to be grieving over 6 months, and yada yada yada. For phantom limb pain, you want to give non-narcotics, and for fresh post-ops, you're going to be concerned about hemorrhage. Later, they might have a contracture. Make sure that the patient lays prone, which is on their belly, for 15 to 30 minutes, and they do their range of motion exercises. And that's it. Good luck.